Chapter 4 of the Bill of Rights guarantees that every Kenyan citizen has access to quality and affordable health services. According to the Minister for Medical Services Anyang Nyong'o, devolution is the key instrument to be used in ensuring this requirement is achieved. The deliberations are to have 22 referral hospitals in place within the 3 years of transition.
But it's important that we have these referral facilities so that they will be developed as centers of excellence to which a cluster of counties will refer patients rather than depending on only 2 referral facilities, Kenyatta and Moi, forever and a day, because the population has increased. We now have devolved government. We must cut down on distances. We must be much more efficient. We must send qualified human resources to the regions.
The right foundation, systems and attitude are being set in place to make certain that the goal is achieved, some being the Health Bill and the Kenya Health Policy Framework 2012-2030 that the health sector has developed to guide the reforms in the sector.
With regard to access to pharmaceuticals, the new bill that has already been approved by the Cabinet and is being forwarded to Parliament transforms KEMSA from a Kenya Medical Supplies Agency to a Kenya Medical Supplies Authority. There's a major difference between an agency and an authority. The authority, in its sense, will receive its resources directly from the Treasury rather than money coming via the ministry. Will be able to develop its commercial wing, for which it has been looking for capital for quite some time.
Irrespective of the provision of a Health Service Commission in the new bill, high shortage of human resource within health facilities curtails greatly the provision of health services.
And 3, the fear of health workers about their job security. I remember meeting some health workers and say, look, we are now going to be at the mercy of the governors who will appoint and dismiss us at will. The new bill, the new health bill we are submitting to Parliament as a section establishing the Health Services Commission. So the Health Services Commission is being proposed not by an act of itself or a constitutional amendment, but through an act of Parliament and the mother bill, the mother law, that within which all regulatory agencies and so on are now going to be governed. So we're going to have a Health Services Commission, which of course has been the demand of many health workers. The Health Services Commission will of course make arrangements on how to second its staff to the counties and the relations between the counties and the Health Services Commission.
And a funding of only 7% of the total expenditure being allocated to health sector remains a big challenge, but Nyong'o promises to engage all relevant stakeholders like Treasury, Constitution Implementation Commission, Transition Authority and Commission on Revenue Allocation who will shepherd the health sector through the transition. Henry Maina, GBS News.